So in order to be as accurate and as safe as possible and to get the best results, you need specificity. And in this system of ours, it starts off with the history. Patient comes in and tells us why he's here. And then we do an X-ray, very specific to the mechanics of the spine. And then we do the examination. Part of it is done with temperature changes and palpation. So there are folks that have come here and they said, well, we've been to other chiropractors. Why should I think something will be different? And my first question is always, did they take full spine standing x-rays so they can see the condition of your spine, look at the history of what's happened to you, look at your particular genetics, and then look at the relationship between each vertebra? So we could be very specific. And I'll probably use that word over and over again because without that specificity, it's hard to get the results that you want to get. See, if you're doing something like manipulation, simply just to move it, I mean, it does a lot of good, but if you're being very, very specific, you can take on cases that are just turned away by other chiropractors. All right. Right there. Mm-hmm. So it's very tender there. It's really not moving well. And there's a lot of swelling all around this joint. So if I push up like that, pretty tender, huh?
Oh, yeah.
Okay, then we'll check the sacroiliac joint to the side here. Bend forward, please. And that one's not moving so good either, right in there. Okay, come on back. Let's check these now. 1, 2, 3, 4, 5, 6, 7, 9, 10, 11, 12, 1, 2. Here's number 2 here. Any tenderness in there, pal? Not too bad?
No, that's okay.
Okay. 1, 2, 3, 4, 5, 6.
Yeah.
And 5. 6 and 5, both very tender. All right, let's check the upper cervical now. Now, this very top bone here, cervical 1, us chiropractors have kind of nicknamed it the Atlas, like the mythical god that was holding up the world on its head. And this bone is very important because the brainstem travels through here. So anything that's putting pressure on this area can affect the entire body. So we've seen it on the x-ray. We know the malposition, subluxation. We record the angle so we could push it back to center. Now, Dr. Gonstead made up this adjustment. It's done with the thumb. So there's no rotation, actually, in the joint itself. Okay, Ben, take a breath. Pull it out slowly. There we go. Good. Okay. Now, this here and in here equally is locked up. So I'm going to do number 6 from this side. Again, tip of my finger on that vertebra. Hold the head still. And breath. And down. There you go. That was a beauty.
That felt good.
That was a beauty. Okay. Now we just stretch them out a little bit and look at the difference in movement. Good. Okay.
So much better.
And again, we know the position. We've taken the temperatures. We know that it's stuck and it's swollen. 1, 2, 3, 4, 5. Big breath in and down. Down. There you go. Good. Perfect. Now, it might look like we're doing manipulation or manipulative therapy, but we're not taking the whole spine and torquing it like this. We're going right to the 5th lumbar. The contact is here. We put it right on that bone like that so we can lift it and torque it into position and then give it pushed in the right direction. Okay, breath and down. There you go. Good. All right. Very good, sir.